Hello, and welcome to another edition of our education podcast. My name is Venipuncture, and I'm here with
Tanisha Cahoon.
And today we're going to talk about venipuncture or blood taking. To start off, you would need to ensure that you're following our IPC guidelines, which is ensuring that you're thoroughly washing your hands and wearing your gloves and apron. Make sure that you get your blue tray cleaned and ready for use. You're also going to need your equipment to take your blood. First of all, you need to ensure that you have your yellow labels, which would determine what type of blood you're collecting and the color of the blood bottles that you're going to need. Also, you're going to use your tourniquet, and then you're going to use your blood collection set. Depending on the size of the vein, you're going to determine either to use the green ones or the blue ones. Then you have to think about cleaning your site. In cleaning the site, you're going to use your hashtag method, which Tanisha is going to demonstrate in a few minutes. While you're using your hashtag method, make sure that you're cleaning the site for 30 seconds and allowing to dry for another 30 seconds. You're either going to use your ChlorPrep or this type. Please ensure that you're not using your green cleaner wipes because this is used to clean medical equipment as has been stated on the packaging. Also, you're going to need your gauze because once you take your blood, you have to ensure that you're securing the site to prevent any bleeding. So you're going to need your gauze, and then you're going to need your tape. You're also going to need your vacuum container when taking blood. Also, you're going to need your pathology bag where your bloods are going to go inside, ensuring that you're taking this to the lab as soon as the bloods have been collected. I'm now going to pass it over for Tanisha to demonstrate how to collect bloods.
Thank you, Vanessa. With collecting blood, always ensure that you communicate with your patient first and foremost, gaining consent and advising them of the procedure to come. I will identify the site of the venipuncture. I will get my tourniquet and I will apply this 3 to 4 inches above the site, ensuring that I tie my tourniquet not in a dead knot.
Tanisha will now demonstrate our hashtag method, our hashtag cleaning method.
I will break the glass and clean using the hashtag. "30 seconds has now passed. I will get my blood collection kit ready. Ensuring I open it safely without touching the key parts. I will get my vacuum now and attach it to the blood collection kit. Now 30 seconds have passed and my area is now dry. I'll get my vacuum collection set, carefully opening it, being mindful not to touch any key parts. I'll get my vacuum and I will safely attach it to the vacuum set. When I have my blood test tube, it would go here, but I would first need to insert. Now that we have prepared our vacuum set, if you look carefully, you will see that one side of the flap is smooth and the other side is a bit corrugated. We will always hold the corrugated side to ensure that our fingers do not slip whilst we are inserting. I will carefully remove the sheath over the needle. We have now finished collecting our sample and we now need to remove our needle.
You're going to ensure that you've got your gauze ready to apply onto the site, ensuring that there's no bleeding from your patient.
Be mindful not to apply any pressure whilst removing the needle. Once you have removed the needle, please apply pressure to the area. Once you have removed your needle, you need to apply or activate the safety sheath by pushing it up and you will hear a soft click. This now goes into our sharps container.
Then you're going to use your tape to ensure that you're securing your gauze.
At all times, always communicate with your patient, ensuring that they are comfortable.
Make sure that you're checking the sites to ensure that there's no bleeding if your patients are on any blood thinning medications. If they are and there is any bleeding, change the dressing and apply more pressure.
Now that we have collected our blood sample, ensure that we document this on the Alex Health system by ensuring that we click sample collected on the Alex Health system. Our blood sample should be taken to the lab as soon as possible.
Thank you once again for watching our video, and we look forward to seeing you in our next education podcast.
Bye.